Are you prepared for a government audit in your organization? Welcome back to the Medcurity podcast. Today, we are tackling a topic that may seem a bit intimidating at first, and that is government audits in healthcare. So you are running a healthcare organization, and one day the government comes knocking, asking for a laundry list of documents to prove that you are keeping patient data safe. What do they want? Why do they care? And how can you be ready? That's what we're tackling today, 11 specific things the government might ask for in an audit. By the end of this, you will feel like you have got a solid game plan to face one of these head on. Let's get started. So first things first, why does this even matter? Well, in healthcare, we're dealing with sensitive data, protected health information, or PHI for short. It's all of the data that identifies patients, like their medical history or billing information. The government, through rules like HIPAA, wants to make sure that you are protecting this information from breaches, hackers, or just bad practices. If you're not ready for the audit, this doesn't mean just a slap on the wrist. This could be fines that climb into the millions. But more than that, it's about keeping trust with your patients. So let's walk through these 11 items together and figure out what they mean for you. Kicking things off with number 1, they're going to want your most recent enterprise-wide security risk analysis, or SRA. If you don't know what this is, it's basically a deep dive into all of the risks your organization faces when it comes to keeping patient data safe. Think of it like a checkup for your organization's security health. Are there weak spots where physical records might be compromised? Are there places in your systems where a hacker could sneak in? You have to look at everything, from your computers to your staff's habits to your facility. Sometimes the government will even ask you when your next SRA is scheduled, just to make sure that you are not treating it like a one and done deal. Completing a security risk analysis is essential. And if you want help getting yours done, reach out to our team at medcurity.com. We will keep this process smooth for you. Next up, number 2, your risk management plan. Okay, so you've done your security risk analysis and you've spotted some risks. Now what? The plan is your playbook for tackling those issues. Maybe you found out that all of your staff's passwords are password 123. Not great. Your risk management plan might say, hey, let's roll out 2-factor authentication and train everyone on better password habits. It's all about showing that you're not just identifying problems, but you're actually working to fix them. Auditors love seeing that you are proactive, not just crossing your fingers and hoping for the best. Moving on to number 3, they might want details on your policies and procedures for dealing with malicious software, like viruses or ransomware. You've probably heard stories about hackers locking up a hospital's systems and demanding a ransom. It happens more than you'd think. Your policies need to spell out how you prevent that stuff, detect it if it sneaks in, and report it if things go south. Having a solid plan here isn't just about checking a box, it's about keeping the bad guys out. Number 4, policies and procedures to record and examine system activity, including audit logs and access reviews. Let's break that down. Imagine someone's logging into your systems. How do you know if it's legit or if it's a sneaky intruder? Audit logs are like a security camera tracking who's doing what and when. Then you have got to review them regularly to spot anything weird. Number 5, your security event response and reporting policy, plus proof that you followed it. So let's say something does go wrong. A hacker gets in or a laptop with patient information on it goes missing. What's your move? The policy is your step-by-step guide. Contain the problem, figure out what happened, notify the right people. Auditors will want to see that you have this written down and that you actually stuck to it when push came to shove. Halfway there with number 6, a full copy of an incident response documentation. Now this ties right into the last one. If something happens, a breach, a glitch, whatever, you need a report that lays it all out. What went down? How did you handle it? Who did you tell? Having this really shows that you are on top of things, not scrambling when the auditors show up. Number 7, evidence that you've got procedures to create and maintain retrievable backups of electronic PHI. Imagine a server crashes or ransomware locks you out. Without backups, that patient data is gone. Auditors want proof that you are making exact copies and that you can pull them up fast if disaster strikes. No data lost, no chaos. That's the goal. Number 8, policies and procedures for encrypting and decrypting ePHI. Encryption's like putting your data in a secret code, only for the right people to unlock it. This is huge for protecting information, especially if it's on a laptop or if it's being sent somewhere. A stolen, unencrypted device can cost an organization big time, fines, lawsuits, etc. Your policies need to say how you encrypt data and how authorized folks decrypt it. Number 9, policies dictating who gets access to ePHI. Not everyone in your organization needs to see every patient's file, right? This is about making sure that only the right people, the doctor, the nurse, whoever it is, right, can get in using things like passwords or multi-factor authentication. It's all about keeping that circle tight. And number 10, documentation showing that you've got hardware, software, or procedures to review activity in systems with PHI. This is like number 4's big brother, okay? You're not just logging activity, you're also proving that you've got the tools to keep an eye on it. Think software that flags weird logins or hardware that tracks access. And finally, number 11, documentation on your employee training program. Your team is your first line of defense, but they're also human. They make mistakes. Training them on how to handle patient data, spot phishing emails, not use work emails on third-party websites, all of that good stuff is critical, and auditors want to see that you've got a program and that it's actually happening. So there you have it, 11 things that the government might ask you for in an audit. That's a lot, but here's the takeaway. This isn't just about jumping through a bunch of hoops, it's about building a system that keeps patient data safe. So start with that security risk analysis. Figure out where you stand as an organization. Build your plans and policies from there. Test your backups, train your team, lock down access. It's like setting up a good defense in a game. You don't wait for the other team to score before you start playing. So real quick, let's think about what happens if you don't have this stuff ready. Fines are one thing, up to the millions if it's bad. But it's also about trust. A breach because you skipped these steps, that's patients wondering if their information's safe with you. On the flip side, being prepared can turn an audit from a stressful situation into a chance to show off how seriously you take this. Now that's all for today on the Medcurity podcast. Thank you for hanging out. I hope this made audits feel a little less scary and a lot more manageable. Catch you next time, and until then, keep that patient data locked down tight.